So this is another key point that also we discuss in this education, and we also presented on behalf of the Spanish transplant and lymphoma groups our results with our experience with the use of allotransplant in patients that relapse after CAR T-cell therapy. So we know that with incorporation of CAR T-cell therapy now is the main option in patients in second line, and these ones that are primary refractory or early relapse, or in late relapses in third line in these patients. So CAR T-cell therapy has a really good results, but unfortunately there are half or more than a half of the patients that will relapse. So we need have a really a lot of things to improve in these patients. So now bispecific antibodies have incorporated in the treatment algorithm of these patients. So we have bispecific antibodies in third line, but also these patients could relapse after bispecific antibodies. So in those patients who are fit and who achieve a complete response with these bispecific antibodies and other strategies, allogeneic stem cell transplantation could really play a role in these patients. So we present our experience in Spain, and the results were really good with a high PFS, taking into account that are really pretreated patients and with a low non-relapse mortality. Also, this study have some limitations because are really selected patients that we only analyze those patients who finally achieve chemosensitivity and finally proceed to the allotransplant. And it will be really important to know from those patients who relapse after CAR T-cell therapy, from these patients who finally proceed to allotransplant. So we don't have this information, but I think that are really, really important results. And we can say that allogeneic stem cell transplantation could be a really good option, a curative option for these patients that are candidates for transplant.